I'm a tissue pathologist or an anatomical pathologist. I work in a very large hospital-based pathology practice in the western suburbs of Sydney in Australia, in New South Wales. My particular laboratory is part of a statewide service, and we're a public laboratory service. My talk was about breast cancer, and I think my career happened to interface with the genomic revolution as applied to breast cancer. And in fact, it's revolutionized how we think about breast cancer. But I think now there are other technologies that are coming in which will add further to what that genomic revolution showed us. And in the end, I think we're going to be looking at artificial intelligence interpretation of the actual way that cancer physically looks. Now that's a sort of an artificial intelligence application to what a pathologist sees. Because a pathologist can see not only the tumour and how that's growing, but also how the individual tissues are reacting to that tumour. So I think it's all going to come together, and it's back to the morphology. The challenges is always money. The challenges are with the aging population and the more people needing access to healthcare, and the fact that the budget could just grow exponentially, particularly with all the technologies available. Precision medicine is a wonderful thing, but it's also an expensive thing. I think the technology is there. I think the problem is going to be paying for that technology. But hopefully things will become cheaper as it goes along, which is usually the way with technology. Pathology Horizons is really good. I think it's really good for pathologists because we pathologists need to know where the big thinkers are taking pathology. And when you come to Pathology Horizons, you have people all over the world who seem to be thinking very much in the future. Pathology Horizons, though, is also good for people who are not pathologists but who are involved in pathology. I think it's very important that they come to Pathology Horizons too, because they're the ones who don't necessarily need to know how to interpret a slide, but they need to know how we can work in the future and the most optimum ways of working in the future. So it's both for pathologists and those who work with pathologists. Also, of course, the talks have been excellent and very varied, and really is showing us the future of pathology. But the other thing is just to chat to the people, both who talk and who aren't talking, and it's a really easy way to do that.